Greeting to all, watching all. My name is Demba Dairra, a national of Mali, one of the greatest country in the Western Africa region by size, I mean. And as a national of Mali, I've been working for the last 35 years rather, for the United Nations Economic Commission for Africa, based in Addis Ababa, Ethiopia, which is closer to India than Mali, hence my presence here. On retirement, I'm now feeling what most you and I think most of my colleagues are likely to feel. It's called back pain, because we spend all our hours, countless hours I should say, sitting throughout meetings or writing reports or traveling across the world. This is part of the job. So at my age now, I think all these years of sitting have taken a toll on my back, or shall I say my spine, because this is where I am now, talking to you from Dr. Hamza's office. What happened was physiotherapy, although it did help a little bit with a lot of painkillers, we realized that it was high time to address this issue head on. And since this is our 4th year running, coming to Manipal Hospital, we've decided that the focus should be on my spine this time around. And that's what we did in the end. I cannot be thankful or grateful for having had the chance to meet Dr. Hamza Shaikh. A quiet man, discreet, articulate, knowledgeable, and yet very humble, who explained to me what was at stake, not just orally, but through copies of the X-rays result of all the tests I was asked to do. But because he was so articulate in explaining to me in simple terms, that I've decided to undergo this spine surgery just 10 days ago. And I can tell you how much I regret for not having done this much earlier than walking like a duck. Because, well, thanks to the Almighty, everything went well, professionally handled, everything on schedule, on time. At least till I could remember before the surgery, everything went well, and after surgery as well. I can tell you that I was and felt that I was in good hand all the way throughout this process. I can only encourage and invite any other who have any doubt or having gone through the kind of pain I did to rest assured that there is always a way out of this pain of walking like a duck, regardless of age, because now medical advancement is allowing this to happen. I can tell you, 2 days after, I was able to walk, though he had recommended me not to do so. But it's just to tell you that it's really minimalist in terms of intervention, invasion. It's something that should be done when required. So with those warm words to Dr. Hamza and his team, I would like to really encourage anybody or discourage everybody not to go the way I did by postponing this kind of surgery. I rest confident that in a couple of weeks I'll be able to regain the fullness of my walking, because I can feel the difference already in just 10 days. So kudos to Dr. Hamza and his team, and we'll continue this conversation because we're human after all. Thank you.
So this patient, Mr. Demba, he is a national of Somali country, and he has come all the way to India with his complaint of low back pain, and which is radiating to his both legs. And because of this pain, he was progressively not able to stand and walk much. And when he came to me, I examined him, and it looks like a neurogenic claudication. I evaluated with MRI, and which showed L3, L4 degenerative changes in the spine, facet arthropathy, and there was a cyst in the spinal canal which is compressing the nerve. So I advised him that in view of this cyst and canal stenosis, that he should require a small surgery. Initially he was very skeptical about the result of the spine surgery, but I assured him and I told the technology advancement that we have here. Now we have a stealth 8 station of the Medtronic, which help in doing all the spine surgery with navigation based technology, and we can do the surgery with a small incision. So I explained him everything about this procedure, so he got ready for the surgery, and we did the surgery, and by God grace the surgery went very well. And immediately after the next day of the surgery, he was standing and walking, and his leg pain got better by the very next day, and he was very impressed by the recovery he was having. And I think it is now the 14th day of the surgery, and he is happily traveling back to his country.